20 years.
And welcome back. It is our third segment of the show this morning, where we are now having a conversation with representatives of the Belize Emergency Response Team. You know them as BERT, and they're celebrating their 25th anniversary. Good morning, gentlemen.
20th. Morning.
20th anniversary, I'm
Good
sorry.
morning.
We have with us Carillo. He is the National Coordinator of BERT. Good morning.
Good morning.
We also have Dr. Rigo Montejo, the Director of the ER Physicians at the KHMH. Good morning. And of course, Arsenio Burgos, the Chairman of the Board of Directors for BERT.
Thank you.
The 20th anniversary. It's been a long road coming this far. What are we looking at in terms of the commemoration of this milestone?
We have a few activities planned, and we are focusing on raising awareness in the community about what BERT really is. And so in the next few days, we'll be addressing, school's out, but we're planning to do some activities for kids, going out in the community, meeting the media, and doing different events. And we are also planning some promotions as well. So we'll be out in 2 areas in Belize City, mainly concentrated, and we'll also be in San Pedro as well.
Now let's go back to looking at the history, the establishment of BERT, and the very critical role that it plays. Let's talk about that.
Okay. About 20 years ago, we had an American couple that came to Belize known as the Wagners, Dick and Bobby Wagner. They came to Belize. Being heads of foundations, they tried to find out what Belize needed. And they found out, of course, a lot of need. But then they focused on the medical area.
Yeah.
And at that point, there was if you recall, the national health insurance that was just about to be rolled out. And they were interested in, of course, ambulance services or response, emergency response. And so the journey began there. What happened was there was a need in that we thought for a while that NHI was going to provide financial services or provide emergency response ambulances. It didn't, and it still doesn't. So we saw the need, and we then established Belize Emergency Response Team.
Yes.
They provided the seed money for the organization. They provided the first few ambulances. They provided our headquarters. They provided the soft money to run the organization as well. The local Belizeans were instrumental in the fact that, yes, it's a needed service. The problem with the needed service is those that need it can't afford to pay it.
Yeah.
And so we went back to the government with that issue and says, somebody needs to pay for it.
Yeah.
The customers or the recipients can't pay for it. Would you be willing to get into a partnership? And at that point, we got into a 5-year partnership with the Wagners providing some of the soft money and the government providing a subventure to provide basically for the emergency. Now, emergency covers, and there's now an agreement, right, that now covers what emergency is.
Yeah.
Emergency basically covers auto accidents, and of course, all the other emergencies that you hear in Belize City, illness, accidents, and of course, what would you call it?
The violent crime.
The violent crime.
Yeah.
Those, there's no time to ask, hey, do you have insurance? Hey, how are you going to pay?
Yeah.
It's a matter of us arriving, settling or stabilizing our patient and hurrying them to Carl Huchner.
Yeah.
That's what's called an emergency. To any other hospital, it's considered a non-emergency.
Yeah.
Carl Huchner then is the emergency.
Now, I imagine it's been 20 years, and it's one of the explanations that I hear BERT having to give all the time, differentiating yourself, that you are not an arm of the government, of the Ministry of Health. You are a private entity
Yes.
with a partnership with the Ministry of Health. How does this pose a challenge for the sustainability of the organization?
At the very beginning, we made it clear that we could not survive without the government of Belize.
Yeah,
As simple as that.
yeah,
And so we came up with a formula based on how much runs we are doing, emergency runs we're
Yeah.
doing per month. And I'm not up to date what those numbers are,
Yeah.
but they were over 1,000 per month.
yeah,
And we came up with a formula as to what it would cost.
yeah,
And we presented that information, and the government agreed to it because they themselves could not provide it. So then we were then set up. What government provides is that subventure and provides duty free for the capital that we may bring in.
okay. So your supplies?
Supplies and ambulances.
Okay.
Most
Yeah.
of our ambulances are donated to us.
Yeah, yeah,
Rotary has been in there, Ashcroft Foundation has been in there, and quite a bit of Rotary clubs from the US. Also, the Wagners have provided our ambulances.
yeah.
Government provides that salary
Yeah.
for most of the service, not 100%,
Yeah,
because we do provide other services for which we charge. Transfers,
Yeah.
non-emergencies,
yeah,
those we charge. Having said that, we can't deny service.
yeah. So tell us about that from your perspective, Andre, as the head of the organization.
What I want to highlight as well is that BERT is a Rotary entity. It was formed by Rotarians, and it continues to be managed by Rotarians. I am a member of the Rotary Club Sunrise. Mr. Burgos is from Rotary Club of Belize. Majority of our directors, with the exception of Dr. Rigo, we're all Rotarians. And so it's a voluntary organization. As with any nonprofit, it's challenging, especially when expenses continue to grow.
Yeah.
We have a lot of challenges, especially during the busy season, in terms of finding adequate staff and having,
There's a busy season for emergencies.
yes.
When is that?
Actually, there's both. The tourism,
didn't know that, yeah.
the tourism season, we see peak in emergencies because we have an influx of visitors in our country.
Okay.
Yeah.
If you consider the number of visitors that come to our country, it's about 3 times the size of our population.
Okay.
So that's when it goes up. Then you look at September. The upcoming September celebration for us is not necessarily a celebration for us at BERT, because we have to ensure that our ambulances are up to par, that we can meet the demands of Carnival. Or emergencies can easily triple on a day like Carnival Day.
Wow.
Christmas, New Year's.
Never imagined that. Yeah.
Right.
Okay.
Christmas, New Year's.
Yeah.
And then
Accidents.
probably one of the largest is when there is a threat of a hurricane.
Okay.
Then BERT gets in and has to move
People from.
people from Belize City to safe haven.
Yeah.
That's public and private sector as well.
Yeah.
So
So I want to let's move over to the medical aspect. Dr. Montejo, talk to us about how the service provided by BERT can assist in what you do at the hospital.
Okay, so basically an EMT should be like my eyes out in the field, provided they're trained and they act safely and judiciously with the best interest of the patient, of course. So I basically joined BERT about maybe 8 years ago. It was like part-time. It's still like part-time.
Yeah.
What I do actually has a specific connotation. It's called a EMS director. And in the US and in other parts of the world, it is a full-time job.
Yeah.
It is a subspecialty in emergency medicine.
Yeah.
I had no idea that existed when I initially started.
Yeah.
I recently completed a training, which was mostly done online. But it opened up a whole new view of how I see EMS in Belize.
Yeah.
But going back to your question, and unfortunately, even in Carillo, a lot of our physicians or our nurses kind of undervalue what EMT does in the field. And that is where I come in, because I now need to train them, educate them, and try to be, the liaison person between what's happening at the hospital, what's happening in the field. And And that is where like accountability comes in as well. Okay, what are the guys doing? Are they doing the proper things? Because we have set protocols that they need to follow in certain situations, in certain diseases, for example. Was this done? Was it done at the right time? Should it have been done? Why didn't you do it? Did you document it? All of those things. So there needs to be harmony between treating a patient in the field. Of course, I know you're like in road traffic accidents, there is this golden hour, or this platinum 10 minutes, which are very important. And they vary from country to country. It's not exactly an hour. And in developing countries, of course, a lot of times it will not be an hour. But it is basically the time that you want to transport the patient.
It's a difference in whether or not the person will survive.
And basically you're trying to prevent secondary injury after accidents, brain injury and stuff like that. And like I mentioned, they should have the capacity and they should be able to relay that information to dispatch back at the base or to the receiving hospital, which in most cases, 99% of the time is Carillo Memorial Hospital. And we should have trust in them. We should reach a point in which the doctor or the nurse on that phone should trust that EMT in the field and be able to gather enough information from him to categorize that patient. This is where that patient is going. This is what I need to do with that patient when they come in.
And be prepared for when they come in.
And this is the team and the equipment I need to have prepared when that patient come in.
Now, one of the things we know about BERT is that you've always worked to have trained EMTs, emergency medical technicians. And I suppose another misconception that you consistently have to try to correct is that an ambulance is not, well, it can be a courier service if you're moving from one hospital to the next, but that's not your role when you head out to an emergency. How do you educate people, as you spoke about educating the staff at KHMH or those who are going to handle the intake? How do you educate them about what the EMT is doing from the point that they receive the call about the emergency?
All right, so educating the community or educating the public is can be very challenging. Right, and it starts like here. In this platform, you could use social media. Like Andrew mentioned, we plan to attack the schools, school children, because if we are getting occupied transferring non-emergency a lot of times, then what will happen when you call for the ambulance for a real emergency? Okay, then we are preoccupied with something else that could have went in their private vehicle or could have called a taxi or something like that. But again, it comes down to educating people, teaching them, giving them the tools, basic recognition of like an asthma crisis versus just a flu, for example. But when it comes to kids and elderly people, there's a very thin line, and maybe lay people will not be able to recognize severity, symptoms, and signs. So it's not just educating them now and then forget about it. It should be a continuous process and stuff like that. No? But it's something that we have to take on.
At 20 years old, what has been the most difficult challenge for BERT in terms of its establishment and the services being offered to the Belizean public?
The challenge starts with the resources, financial resources, and that creates a ripple effect on everything else. Being able to supply the ambulances, being able to keep up with the standards and ensuring that you have qualified EMTs. This is a challenge not only in Belize. If you look at the UK or statistics from developing countries, they're also constrained to staff ambulance services. And so it's not unique to Belize. It's just a challenging environment. Because it's a very expensive service, the general public simply can't afford it. And so it generally becomes either a humanitarian service, and because of the humanitarian nature, then it constrains the resources internally. And that affects operations. So really it starts with having the resources to be able to staff and to have the equipment and supplies and even adequate ambulances. BERT we've been lucky to have ambulances, enough ambulances for the needs, but they're donated, and when they're donated to Belize, they're depreciated.
You get what you get. And in ambulances, we would like new ambulances. We're not getting new, we're getting used. And sometimes we end up we do spend quite a bit of our resources in just keeping our ambulances in maintaining. The other challenge that you have is a continuous rise in costs. And our partner that provides the financial resources sometimes does not recognize that increase. The latest challenge we had was when the EMTs were recognized as a semi-professional in the medical field by the government of Belize and put them on a salary scale that was much higher than was being paid. And that created a crisis for us where our EMTs were leaving. And of course, the ones we were having were overworked, etc. We had to go back to government and renegotiate subvention. And since we've done that, it's been about 2 years, 3 years.
Yeah.
About going into 2 years.
Things have smoothed out a bit.
Yeah.
But with the rising cost of fuel,
Well, I was going to ask
It's
about that. Do you get
always-
incentives in fuel purchase? Because you have to be mobile most of the time.
Noticed, yeah.
we're not fortunate.
We're offset by the subventions, and then we get duty waivers on the importation of ambulance and medical supplies
it,
only.
yeah.
It's on a case-by-case basis.
But not on fuel.
Not
Not on
on fuel.
So
Now,
the
I'm-
other challenge, you
Uh-huh.
asked challenges, the other challenges has been what Andre will tell you is our second arm, and that is of training. BERT has decided that we will do emergency via the hard line, which is ambulances, but you need to provide training. And we have provided training to EMTs, not just for BERT, but countrywide. BERT is limited to Belize district.
Yeah.
So we provide training, however, for the entire country. And one of the challenges we're having is we would like all EMTs to fall under a standard training protocol.
Yeah.
That they are actually certified, and I guess every once in a while refreshed
Recertified.
and
Yeah.
recertified. And that's one of the challenges also that
So
we're
what's the
trying to do.
challenge there? That they don't need, that they're not required?
Once they leave our classroom and they leave our required ride-along hours, then they pass the exam, they get their license, which is signed by the Ministry of Health, by the Director of Health Services. They go to work in Carillo, in Rigo, in Punta Gorda, and we don't see them again for a whole year.
So they don't have a requirement like doctors do for the continued medical education?
No, so I am as medical director for BERT, not for the country, for BERT. I am starting that with
Yeah.
my EMTs here in the city to
Yeah.
do continuous medical education. There will be a set number of credit hours that they will need to meet
Yeah.
per year. And this is something that the other EMTs, even though they were trained by us,
Yeah.
they don't fall under that
Okay. Yeah.
right here.
No, I can see where technology changes so quickly.
Yeah.
The level of understanding and knowledge we have of different issues can change year to year. So it'd be beneficial to stay up to date.
Yes,
Now, I'm trying to think of what it was like 20 years ago, or even 5 to 10 years ago. The population size, let's start there, has changed, which means the demand that you have is very different. But also the level of violent crime that we see in the city specifically, and road traffic accidents. Better roads also means that people are speeding as well, having more accidents. How do you, what is your current fleet and personnel level, and how do you ensure that what you have is adequate for the amount of demand that you have?
We have, based on a memorandum of understanding that we have with the Ministry of Health, we are mandated to have 18 EMTs. And that allows us then to create a schedule. You see,
Yeah.
the challenge is to be able to plan not for
But that agreement was made what? How long ago?
2 years.
2 years ago. So 18 is what 2 years ago they thought was sufficient to meet the demands.
Yes.
Okay.
The challenge with EMS management is that you need to be prepared for the mass casualty events, the
Yeah.
serious events, and you have to be constantly overstaffing, not to meet the average day-to-day emergencies. It's really being able to plan for those events, those one-off events. And so we plan our staffing on schedules. And so we have a primary ambulance, and then we have a backup on-call. Then the crew that comes off the schedule prior, they're a third on call, which is a bit challenging to those who probably would have come off a 24-hour shift, a
Yeah.
12-hour shift. Generally, we don't use them, but they still remain on call
Yeah.
in the event there would be a mass casualty. But the golden number 18 that we have in the Belize district allows us to provide the land ambulance services. We also complement our services to the rest of the country through our air ambulance. As you recall, in 2017, we were beneficiaries of an airplane that was donated to us from the Wagner Foundation and Burlington Rotary Club from Wisconsin. So we are able to go to the districts and the regional hospitals to be able to complement that service,
Yeah.
although we don't have the land ambulances there.
Okay. And the number of ambulances that you have?
We have about 6.
Okay.
And that's the number that we keep. It allows us to do primary, secondary, and if we have a mass casualty event, we are
Yeah.
able to provide the additional.
Now let's tackle the public perception. One of the things that people always complain about is, or we will always hear in an emergency is, oh, the ambulance took so long to get here. Tell me what you would say to the general public about this issue, and what we can do to improve the information flow from our end.
Get trained. You can make a difference in saving someone's life. Really and truly, we've taken on this service from a humanitarian perspective,
Yeah.
but the public can make a difference in getting trained as well. You can save a life. We provide training from basic to advanced life support, but basic first aid is key in that initial patient contact when an emergency arises. So if you're trained and you know what to do, you can also assist.
Yeah. And the response time?
Our number is 10 minutes. The platinum rule is 10 minutes, and we aim for that. However, due to the sparse nature of the country itself, sometimes we are on the highways dealing with road traffic accidents, and that primary or secondary ambulance that might need to go to a mass casualty incident, it's constrained then. And that is really and truly, we're because of that constrained nature, we then we get backed up. But this is where training comes in, and that's what we would like to say to the general public. Get in touch with BERT, call us. If you know you have someone at home living with an ailment, diabetes, whatever it is, and you know they're at risk, get trained. You can make a difference in saving someone's life.
The other thing to remember, right, is we can tell you it takes 10 minutes. But when you are personally in that situation,
10 minutes is a lifetime.
somehow seconds appears to be minutes.
Yeah.
So 5 minutes appears to be a very, very long time when one of your loved ones is, and
Yeah.
you see all of this blood or whatever it is,
Yeah.
and you start to panic. It is that difficult.
Yeah, or measure of time is a lot different.
Completely different. So the 10 minutes appreciate also in Belize. Our streets may also be, what would you call it, congested.
Yeah.
We sometimes have difficulty getting on site.
I was going to
To the
ask, are
places.
people respectful to giving way to ambulances in Belize? What do you find as a general rule?
You always have the.
No.
It's an honest answer.
No, but you should, because we always follow different rules depending on where we are as Belizeans. And I always see sometimes, because we're so close to the hospital, the ambulance, and I wonder how much people actually pay attention. And we were told they won't always have the sirens on that you can hear, but you should still respect it the same way either anytime you see them. What do you want to tell people about that? That's good education.
That will help decrease the response time.
Yeah, yeah.
That will help decrease the response time. And what I would like people to know is that, like Mr. Burgos mentioned, that 5 minutes might seem as 30 minutes, but we want you to know that we're doing our best. It's not that we are taking our time or the driver is on his cell phone and driving the ambulance and don't care about where you are.
Yeah.
And try to be as descriptive as possible when giving address.
Yeah.
When giving addresses, because sometimes the ambulance, the guys, they just say, okay, it's a blue house at the end of such a street.
Yeah.
Sometimes the houses don't have number. We have to be realistic.
Yeah.
I mean, in the city, sometimes the houses don't have number. But try to be as realistic. You could come out inside the house and wave a certain color of clothing or whatever to help the guys locate your patient, your relative as quick as possible.
We also often hear people say, call BERT directly.
37, there's
Yeah.
a 7-digit number. For
Yeah.
that,
Yes, it's 223-3292. That's
Yeah.
our emergency number.
Yeah.
However, if you go through the 911, it's routed to the police department that assesses the emergency at that point in time, and then call us. That's minutes, that's seconds that is lost at that point in time as well.
Yeah.
Yeah.
So if you call us directly, you have a dispatcher who is also an EMT, and they may also assist with intervention. We do over the phone CPR many times, especially in the rural communities. When we know a patient needs it, our dispatcher gets on the phone with the relatives and
they
ensure
talk
that we
you
can
through
start
it.
saving a life right away.
Perhaps the biggest thing is just to reduce that panic level.
Yeah.
Which is easier said than done.
I don't
Easier
know.
said than done.
Depends on the situation itself. And one of the last points, because we're quickly running out of time, before we talk about your anniversary celebration, is something that we consistently see when we report on traffic accidents. People say, "Oh, the ambulance is taking so long," so they pull the person out of the car, put
is
them in
wrong.
their vehicle,
Which is
and
wrong.
take them
Very
to the
wrong.
hospital.
That's very wrong.
Tell us why it is important that we wait on, or how long should we wait?
So especially if the patient is unconscious, you shouldn't touch the patient unless the patient is in direct danger of the car getting on
Exploding.
fire or
Yeah.
exploding or is at the edge of a cliff or something.
Yeah.
Otherwise, you should wait. If you are an experienced first aid person or even basic life support person, you could check for vital signs of life.
Yeah.
But other than that, you should wait for the professionals or the semi-professionals, like Mr. Burgos put it, to arrive and assess the situation, because first and foremost, scene safety, even an accident, a fire, anything, the scene safety is important. Is the scene safe? Because sometimes EMT might even find himself in a situation that the patient is trapped inside the car, is alive, and he might have to get in the car with that patient,
Yeah.
right? And not just wait for the patient to get taken out of the car.
Yeah.
But this is something, throwing people at the back of a police, even a police pickup, is very wrong, because you can worsen secondary injuries like spinal injuries,
Yeah.
or even a bone that's fractured and is near a big vessel. If you manipulate that limb irresponsibly, or ignorantly because you don't know, then you can lacerate that vessel and that person can bleed to death, even before they arrive at the ER.
Yeah.
So it's something to think about. Even though you are trying to do it in the best interest of that person, you are not skilled, you are not trained to do that.
Yeah.
Okay, so
All right. And with that said, let's talk about how you'll be commemorating the anniversary.
Okay, so we have planned activities for the media. We plan to hit the ground actually, and we'll be working with various media houses. There are emergencies that we know constrain our services. Diabetes is one of them, for instance. So we plan to go out on the streets and talk to the residents, raise awareness, put our emergency number out there, remind the public that we're here. We'll do a few more morning shows, perhaps with the Belize Diabetes Association. We plan to join other institutions and their causes to help raise awareness, because at some point or the other we are all related. So we will do a session in San Pedro as well for women. And we also will be doing our morning show in Belmopan to raise awareness about the dangers of road traffic accident. And so we look at healthcare, the crisis in Belize in terms of the growing number of emergencies and road traffic accidents. And so we have radio events, we have giveaways, promotions, we have donations from various organizations that will help us get our message across.
All right. Well, congratulations on achieving your 20th anniversary. And best of luck as you continue to push forward with this essential service.
Thanks.
Thank you.
All right, we're going to go ahead and take our final break. And when we come back, we'll have our wrap up, so stay tuned.